Donnell Kalsched, in his book The Inner World of Trauma, uses the term trauma to refer to experiences that cause extreme psychological pain or anxiety in a child. These experiences are unbearable because they overwhelm the child's usual defenses that protect against stimuli, as described by Freud. Trauma can come in different forms, ranging from acute and devastating incidents of child abuse that are commonly discussed, to more gradual and cumulative traumas of unmet dependency needs that profoundly impact a child's development. These traumas may also include the acute deprivations of infancy described by Winnicott as primitive agonies, which are too overwhelming to be fully understood. The defining characteristic of such trauma is the intense fear of disintegration, described by Kohut as disintegration anxiety, which is associated with the imminent breakdown of a cohesive sense of self. Experiencing such anxiety poses a grave threat to the entire human personality, risking the destruction of one's personal spirit. Therefore, to avoid this outcome at all costs, a second line of defense comes into play when such trauma occurs in early infancy, before a coherent ego with its defenses has fully formed. These defenses are known in psychoanalytical terms as primitive or dissociative defenses. Examples of these defenses include splitting, projective identification, idealization or demonization, trance-like states, shifting among multiple identities, and so on. Dreams shows that when a child goes through a traumatic experience, it can cause their mind to feel like it's broken into pieces. These pieces of the mind, which we can call splintered psyches or complexes according to Jung, organize themselves in specific ways, usually as pairs or groups of personified beings. Typically, one part of the child's mind goes back to behaving like a baby, while another part grows up too quickly and tries to act like an adult, often pretending to be someone they are not. The more grown-up part of the mind then takes care of the regress part, like a caretaker. In dreams, the regress part of a person's personality is often shown as a vulnerable, young, innocent, sometimes feminine child or animal version of themselves that they keep hidden in shame. Sometimes, it may appear as a special animal like a beloved pet, kitten, puppy, or bird. Regardless of its form, this innocent part of the person seems to represent a core aspect of their unchanging personal spirit, similar to what the ancient Egyptians call the Ba soul, or in alchemy, the wing animating spirit of the transformation process, also known as Hermes or Mercurius. Meanwhile, in dreams, the progress part of the personality is often shown as a powerful and either benevolent or malevolent being who either protects or persecutes the vulnerable regress part. Sometimes, this protective or malevolent figure may appear as an angel or a miraculous wild animal like a horse or a dolphin. However, more commonly, this caretaking figure is portrayed as a demonic and terrifying to the dream ego. Together, the progress versus regress parts of the self, as depicted in mythologized images in dreams, form the psyche's archetypal self-care system. This system is archetypal because it is both ancient and typical of the psyche's natural defense mechanisms, and it develops earlier and is more primitive than normal ego defenses. These defenses are believed to be coordinated by a deeper center in the personality than the ego, and have been called defenses of the self. This theoretical designation is fitting as it highlights the powerful and awe-inspiring nature of this mythopoetic structure, and the malevolent figure in the self-care system represents the dark side of the ambivalent self, as described by Jung. The self-care system is responsible for regulating and mediating the inner and outer experiences of a person, just like the functioning ego does in normal conditions. However, a problem arises when the self-care system is organized as a defense mechanism in response to trauma. It creates a barrier that screens all interactions with the outer world, preventing unguarded and spontaneous expressions of self. While it may protect the person from further trauma, it also inhibits their ability to live creatively. In such cases, psychotherapy becomes a necessity.